So checklists have been around in healthcare for quite a while. Actually, an article in the New England Journal of Medicine published in 2009 called a surgical safety checklist to reduce morbidity and mortality in a global population. Really brought to life a lot of really interesting stats as far as just back then, and it's grown since then, but estimated 234 million operations performed yearly around the world. And the study in industrialized countries have shown a rate of death from inpatient surgery of 0.4 to 0.8%, and a rate of complication of 3 to 17%. So the risk of operation is extensive. Data suggests that at least half of all surgical complications are avoidable. So previous efforts to implement practices designed to reduce surgical site infections and mishaps have been shown to reduce complications significantly. But a growing body of evidence also links teamwork in surgery to improved outcomes, with high-functioning teams achieving significantly reduced rates of adverse events. So a study was done between October 2007 and September of 2008. 8 hospitals in 8 cities around the world, representing a variety of economic circumstances and diverse populations of patients, participated in the World Health Organization's Safe Surgery Saved Lives program. So the innovation was actually 2 steps. They collected baseline data previous to implementing the surgical checklist, and then they gathered data after they implemented that checklist. And it was based on the World Health Organization's checklist released with approximately 19 items to check actually at 3 different junctures within an operation. The rate of any complication at all sites dropped from 11% to 7% after the introduction of the checklist. The total in-hospital rate of death dropped from 1.5% to 0.8%. And during the baseline period, they looked at 6 safety indicators overall, including airway evaluation, pulse oximeter use, central IV catheter present, prophylactic antibiotics given appropriately, and oral confirmation of patient identity in operative sites, and sponge count completed after the surgery. All 6 measured safety indicators performed 34.2% of the patients before the checklist was implemented, and then increased to 56.7% after. So this is just one study that shows significant improvement in the care and the outcomes and the decrease in complications based on a surgical checklist available and used at the time of surgery. Clearly, there are other opportunities within healthcare for these checklists, but what we'd like to do is provide a better solution to provide checklists with easy access and actual data capturing capabilities real time across your facility. So a very scalable solution, easy to update, easy to manage, easy for your clinicians to use, easy to improve quality, improve patient care and safety, and improve outcomes. Atul Gawande, the author of the Checklist Manifesto, actually was a part of that study that I just mentioned, and he obviously wrote this book, highly recommended book, on the value of checklists in healthcare and what they can do, how many lives it can save by reducing the complexity just a little in healthcare and reducing the cognitive load that's placed on clinicians every day during their shift and during patient care. The scalability, usability, and the accessibility of reporting and analysis of a point-of-care checklist solution has the potential to make a significant difference for your facility and your patients.